All right. I think everyone has settled in. Thank you for sharing part of your day with us. Let me tell you, we're going to talk about food and mood, the neurotransmitters and key nutrients to help you keep that balance, and a little bit about who we are. Aligned Modern Health is a clinic system that uses integrated medicine to care for our patients. We combined chiropractic physical medicine along with active care, rehab, I should say, acupuncture, functional medicine, and clinical nutrition, as well as clinical massage. What makes Aligned Modern Health unique is the fact that we combined and integrate these different modalities of care for our patient. We target the treatment to be tailored to what they need. We incorporate not only their health goals, but obviously their health history, what we find on the examination, and we combined all of that because what we want to do is get to the root cause of the issue so you can lead an optimally healthy life. So with that said, I get to tell you that I'm pleased to be a part of Aligned Modern Health. I'm Dr. Delilah Reniger, and I have the pleasure of leading two of those particular care models, the chiropractic physical medicine as well as the functional medicine team. So let's get to it. Let's talk about mood. First off, let's define mood. And mood is considered the temporary state of your mind or your feelings. Different from emotions or feelings, mood is typically considered a little less specific, a little less intense. We typically grade mood kind of as I'm in a good mood or I'm in a bad mood. And the other thing that's pretty particular about this is we often cannot pinpoint a particular stimulus or event that determined our mood. Unlike the cartoon here where it looks like he's probably going to be in a bad mood after that start, we can't always tell. I really want to reach out and tell Howie, turn over, get off on that other side of the bed, have a great day kind of a deal. So what can affect our mood? Our overall health status is definitely one of them. When you are dealing with either a chronic injury, a chronic infection, chronic inflammation, or even nutritional deficiencies that you may not be aware of, those all affect your mood, maybe in subtle ways where you don't even realize, but they do have an effect. The environment and temperature. If you're not really sure how that is, just wait till we turn the clocks coming up here very shortly, that daylight savings time. We definitely know it has an impact on not only our body, but our mood. Think about on those really frigid days or those hot, humid days in August. They impact how you feel. They impact the state of your mind. They impact your mood. Exercise, both too little or too much, can impact. We'll talk a little bit about how that works in just a moment or two. Hormonal factors. On the hormonal side, when you are in a constant state of stress, then that affects your cortisol levels, that affects your hormonal levels all around, including your libido hormones, and those affect how you respond to the world and the level of your mood. If it's a low mood, good mood, bad mood, that sort of thing. Socioeconomic factors and current events. Right now, I don't think I have to say any more how we know they can affect our mood. Supplementation, whether it's a over-the-counter vitamin, a mineral, an herbal, all of those things can directly impact your mood because they can directly impact some of those precursors in your body, that precursors that lead to the mood changes. And then on therapeutic interventions, obviously we can have drug interventions, and that's probably a little more widely known, but we also can have interventions from a physical perspective. We can have acupuncture, we can have massage, we can have chiropractic adjusting. All of those things actually input to us to influence our mood. Genetics, Genetics often play a role, but one of the things I always want to caution when we talk about genetics, yes, genetics are something that you get. Mom, dad give you those, and that's the way it is. But how they express is where we have that influence. So there are mood disorders that are genetically predisposed, but there are things that can be done to reduce their expression or the chances of their expression. And then, of course, what we're going to talk about today, and that's the diet and the food choices for influencing your mood. Before we get to that, let's talk about mood and some of the terminology that we use. Mood is regulated, just like everything else in the body, by some regulatory substances, some very powerful chemicals in the body that help regulate both the physical and emotional processes that are going on. And of course, I'm talking about neurotransmitters and hormones and how they balance. So let me tell you the difference between neurotransmitters and hormones. Location. If the hormone is above the neck, meaning in your brain, we call it a neurotransmitter. If a neurotransmitter is in the body, we call it a hormone. And some can cross and some cannot. But that's strictly the location. So when you hear hormone or neurotransmitter, I want you to think about that it's a powerful regulatory substance that directly influences and is looking to signal a response. It's a messenger. It's what we call a special messenger. So we're looking here on the balance because depending on their concentrations and their balancing with each other, that's going to give us our mood. We're either going to be in a good mood where we feel more directed, more motivated, more vibrant, or we're going to have an imbalance of neurotransmitters or even a deficiency, an inadequate amount, and we're going to feel stressed and sluggish and out of control. On this particular slide, there are 6 neurotransmitters that we talk about in particular. Would it surprise you to know that there are over 100 neurotransmitters in the brain? But we do talk about these in particular. Adrenaline, I think probably everyone is familiar with that, with our fight or flight. That comes from the adrenal gland, and that's the one that wants you to get out of Dodge if something's going wrong. Noradrenaline, that is our concentration. All of these have duplicate intent, but they typically have a primary focus. And for noradrenaline, or the other term you'll hear is norepinephrine, that's a concentration neurotransmitter. Dopamine is what we call the pleasure neurotransmitter. We'll talk about that one specifically. Serotonin is a mood enhancer, mood stabilizer. This is probably one that people are also familiar with if you are reading, anything in the health world, that serotonin is one of the biggest drivers of not having enough. Let me clarify, not having enough of it is one of the bigger drivers towards anxiety and depression as far as the neurotransmitters go. GABA is a calming neurotransmitter. Acetylcholine is focused on learning. Glutamate on memory. And then the endorphins, everyone I think is pretty familiar with the exercise or runner's high because of the endorphin production. It's kind of an interesting note. Endorphins are definitely something that produce that euphoria. They actually help pain control, but we don't think that that's what's responsible for the runner's high. What we think is, or what's being shown right now, is it's actually a chemical called endocannabinoid. I cannot speak on that today. Let me try that again. Endocannabinoids that actually are responsible for the runner's high. So the endorphins do impact us in the body, but maybe not actually in the brain. So if we have a neurotransmitter imbalance, bottom line is it's going to eventually manifest for the person, one way or the other. Whether or not you have chronic pain that's not responding to care, you suffer from fibromyalgia, You may notice that your thoughts are becoming a bit more obsessive and your actions a bit more compulsive. These are things that can begin slowly and almost subtly and insidiously, and then begin to ramp up as the neurotransmitter imbalance gets worse if it's not addressed. Migraines are related to this. Hormonal dysfunction, we mentioned. Irritable bowel, GI symptoms can be related to this. Of course, this has a component for eating disorders in a lot of situations. Insomnia, panic attacks, and of course, anxiety and depression. I'm sure you can picture if you suffer from any of these, oftentimes sleep is disrupted. If you also then have insomnia on top of it, that can bring on anxiety. That can then have a component of depression. So as you can see, as this progresses, it's very clear that a lot of these begin to overlap, and it becomes a fairly big, muddy mess of symptoms, but it can be traced back. That's what we talk about, getting to that root cause. So some of the key regulators for mood are going to be your serotonin, your dopamine, and norepinephrine, or the noradrenaline is the other term for it. Let's talk about serotonin. Serotonin is probably, again, the most common contributor to mood concerns. There are whole classes of prescriptive pharmaceutical drugs to address this. But before you get to that point, there are many things that we can do and that you can talk to your provider about. But serotonin is one of those keys for feeling happy and for giving us that balance in our emotion, which obviously, if you're feeling happy, you're less likely to feel that anxiety and obviously less likely to feel the depression. As we increase our stress levels, serotonin is naturally depleted. So we have to be paying attention on how to replenish those. Because again, those indicators of low serotonin, we've already mentioned that low energy, panic attacks, that obsessive and compulsive component of thought and behavior, reduced libido and interest in sex, sleeping problems, waking up not feeling refreshed. All of these, along with hormonal imbalances, and we talk about women a lot with the hormonal imbalances, whether it's premenstrual or menopausal, but I want to really make sure that we take care of our male counterparts in the hormonal world, that these hormones can affect anyone, not just thinking about the menopause or pre and post situations. So please don't, if you see that and go, oh, it would only be menopause or it would only be that. Nope, across the board, it can affect those hormones. And then, of course, the hard part is the feeling of sadness and depression and anxiety. When you start to feel those, that's when it can be a bit more difficult to address them. By the sheer symptom that you're feeling, you may not have that energy to address. So that's why it's so important to be in tune with how you're feeling, know those things that are coming along, the stress that you might be feeling. Talk to your partner about, are you a little more irritable than maybe typical, and what's going on with that. And then, of course, what we love from a aligned modern health point of view is taking care of it all the way around, from the food to your exercise to your sleep, all of those things that will help you feel better. But obviously today, let me go back one. We're going to talk more about food. So let's talk about the other two key neurotransmitters, dopamine and norepinephrine. I've already mentioned dopamine is that pleasure neurotransmitter. That is the one that we associate with love. By the way, chocolate produces dopamine, and that's one of the reasons why we think that chocolate is associated with Valentine's Day. You want to have your recipient feel that dopamine rush, so they associate you with those loving feelings. But dopamine and norepinephrine are responsible for that drive, that interest, the energy and motivation, which obviously is when you're in love, that mood, how you feel after exercise, that elevated, that good feeling you have, listening to music, that relaxation, that focus, and then the mood, of course, I've already mentioned during and after sex. If you are deficient in either one of these or you have an imbalance, you can have difficulty actually even initiating a task or completing it. Your concentration can be affected and be poor, lack of motivation, and lack of energy. So the three neurotransmitters that we talk about that are key, the serotonin, the dopamine, and the norepinephrine, they impact a very large chunk of most people's lives. Again, mood, concentration, cognitive ability, motivation, physical well-being, and that emotional well-being. So I got ahead of myself a moment ago because I get excited when we can affect something so impactful in our lives and in our health by something as readily available as food. And I would like you to think about food maybe in a different way than you have previously. Yes, it's for the nourishment of our body, but it's actually information. Food is literally packed with messages. So I want you to ask yourself, are you sending the message to your body of a love note from your food? Or are you sending a nasty gram? Because whichever one you are, the body's going to get the message. You are going to reap that benefit. So I hope from this point forward, you'll consider sending a love note to your body, because literally approximately 37 trillion cells are going to get that message. The food, particularly obviously nutritious food, is going to help us create and produce and then balanced levels of neurotransmitters. So if you're having your lunch right now, your gut is breaking down those macro and micronutrients. Macro are your carbohydrates, your proteins, and your fat. Those micros would be your vitamins, your minerals, and your phytonutrients. And you are sending your body a message right now. Out of everything in the body, I think this is my favorite part, and that is the gut-brain connection. The gut is, the GI system is the only organ system in the body to have its own nervous system. It has its own dedicated nervous system. We call that the enteric nervous system. There is more information going from the gut to the brain than there is the brain going to the body. So really, your brain is run by your gut. That's really the bottom line. And because of what goes on in the gut, that directly impacts those neurotransmitters. So the other piece of this, and if you've had the opportunity to attend previous digital docs, you may have had that opportunity to learn about microbiome, to learn about good gut bacteria and what have you, because the bugs that are in your GI system, not only are they in there helping you digest the food, but actually produce in your own body antibacterial to help with pathological bacteria. They help produce vitamins. They produce vitamin K, for instance. They actually help produce some of your B vitamins. And all of these are part of that system to help you balance that neurotransmitter, both production and levels. So when we talk about this, what do we need to produce these three neurotransmitters in particular that we're talking about? So starting with serotonin, we need to start with something called tryptophan. And tryptophan is an amino acid, which is a building block of protein. So when you eat protein, if it's a complete protein, which it means it has all of the necessary ones you can't make amino acids, and tryptophan would be part of that complete protein, your body will then turn that tryptophan into serotonin. But it needs a little help. It needs vitamin C, it needs biotin, B7, magnesium, it needs omega-3 fatty acids, it needs B6, B9, and zinc. So it needs these vitamins and minerals to start with the tryptophan and get it all the way over here to serotonin. 80% of serotonin, approximately 80% of serotonin, is produced in your gut. So if you have any gut dysregulation, if you suffer from any of those things of irritable bowel or digestive issues, you are putting your serotonin production at risk. You may not know it now, but as time continues, we typically see that deficiency. For dopamine and norepinephrine, we are looking for tyrosine, another amino acid of those protein building blocks. And with tyrosine in combination with iron, niacin, B6 peroxidin, and folate B9, those four things together help the body make dopamine. And then dopamine actually is where we get norepinephrine. And that is dopamine with vitamin C and copper. We get our norepinephrine. So if we can start off with enough key nutrients to make our serotonin from our tryptophan, and we can start with enough key ingredients from our tyrosine to get to dopamine, combine that vitamin C with copper, dopamine, now we're cooking. Now we've got our norepinephrine. So we've got those key neurotransmitters that are being produced in an imbalance that are going to help you stabilize your mood. So of course, the big question is, where do I get the foods that are going to help me make my neurotransmitters? Where do we get them? We get them from the following. And if you think of that rainbow plate that we often talk about with the different colors of the different foods, a wide variety, that's really what we're looking at here. Your B vitamins are looking at, salmon, which obviously is also a source of your omega-3 fatty acids. Eggs have them. We're looking at dark leafy greens. We're looking at even nutritional yeast, if there are things on here that you might not want to eat. Avocado, almonds, our sweet potatoes, whole grains are a big deal. And of course, some of the legumes, particularly chickpeas and lentils. Liver is also on there for those of you who might care for that. Those are high in your B vitamins. Vitamin C, now we're talking about, again, a bunch of different fruits and vegetables, everything from your strawberry, your cauliflower, your kale, cabbage, wintertime. We're coming up on St. Patty's Day. So there are things you can benefit from all year around. You can do that seasonal eating and still, with a wide variety of food, get your nutrients in. And then the omega-3 fatty acids, those are going to be your cold water fish, salmon, of course, sardines, herring, if you like, Brussels sprouts, cauliflower, they also have it. And some of the nuts, flax seeds, walnuts, they are also have a nice balance of omega-3s. One thing I do want you to take note here is it says grass-fed beef. And that is different than grain-fed. Grain or corn-fed, they typically have more inflammatory omegas, and the omega-3 is your anti-inflammatory. So that's why you'll see specifically saying grass-fed beef. So for zinc, we're looking at, again, grass-fed beef, spinach, asparagus, mushrooms. Shiitake and cremini in particular have a high level of zinc for you. Magnesium, again, we're looking at some of those leafy greens there with Swiss chard and spinach. Turnip greens, pumpkin seeds, or beet greens are also wonderful. Iron, I think everyone always thinks about spinach, but there are many choices. You can do parsley, you can do leeks, are the beet greens, collard greens, all of those offer you choices for iron. And then copper. Again, if you notice, we're seeing a repeat here. We've got our greens, we have our mushrooms, we have cashews. So by eating these really nice, healthy foods, you have a great opportunity to improve your nutrient intake, which will then support making neurotransmitters. Another way that we want to improve the mood is by promoting good gut health and supporting that. So fermented foods helps with that microbiome. Collagen, bone broth is another good source. How you eat and when you eat can also make a difference. When you're eating, timing can be everything, depending on your need, and you may not have it figured out yet. That's where it would behoove to talk, excuse me. It would behoove you to possibly talk to your provider on, is intermittent fasting appropriate for you? Or are you someone that should have small, frequent meals? Blood sugar regulation plays a role, whether or not you have other GI issues. So all of these things may work for some and not everybody, and that's what you want to figure out, what's appropriate for you. And I mentioned eating seasonally. Look at the foods that are in season during the fall, the winter, spring, summer, and concentrate on those. That's when they are at their peak, and that is when the body is ready for them. How we combine the food plays a role. In order to feel blood sugar balanced, feel mood stabilized, as well as satiated, you want to have those macronutrients together, your carbohydrate, your protein, and your fat at the meal. And when we talk about a carbohydrate, we are indeed talking about a complex carb. So we are talking about your fruits and your vegetables, and we're talking about eating them in their more natural state. In other words, you want to have to chew them. So cooking is fine. I will talk to you, mention juicing, people will ask me about. No, I want you to chew your food. Your digestion actually begins in your mouth, and the better you chew, the more you begin to break down the food. You get those nutrients. It prepares the food to go down that digestive tract. So we want that balance. We want that fiber in those foods as well. And then we talked about those foods, particularly for serotonin. And we pull serotonin out of the neurotransmitter bunch in particular because it absolutely is key for feeling mood elevated and feeling stable and not having that tendency towards anxiety and depression. So foods that are rich in tryptophan, which is, we know, combined with those other nutrients, converts to serotonin. We're talking about turkey, we're talking eggs, nuts, seeds, that's salmon. So you want to combine those with those leafy greens and those good complex carbs to optimize creating the scenario to make serotonin. Once you influence your neurotransmitters, you'll find that you can have an elevated mood, you can feel good, you can say to people when you see them, how you doing today? Good day, I'm in a good mood. You know, whether or not you realize why, you'll know that it is directly related back to what you're putting into your body, because now you're sending your body those love notes versus nasty grams. I want to thank everyone for joining us. I'm going to open up the Q&A and we will see what we can do. The question is, and thank you, it's a very good question. There are many foods on the list that may not suit you due to other issues, autoimmune issues. Again, nightshades is a food group that may not suit. That's the beauty of this. There is many foods that can supply you the nutrients and stay away from those food groups. I myself don't tolerate nightshades, so I understand completely as you're mentioning this question. This is where you want to look at your goals, your health issues, and you want to do it with a clinical nutritionist, someone who can actually help you decipher through and say, okay, this is off the table for you. However, here's a great substitute that's going to give you those same nutrients without getting your, without running into those foods you shouldn't have. My next question is it okay to drink your vegetables in smoothies? Yes and no. And I'm sure you can find many diverse opinions on it. I will tell you, if you want an afternoon pick-me-up and you make a smoothie, I think that's great. But I will tell you that the fiber in the smoothie helps regulate the blood sugar. The chewing actually has physical effects, and breaking down that fibrous component, the meaty component of that vegetable, is a important part of your digestive process. I would tell you, if you were getting all of your vegetables in a smoothie, I would not advise that. But here and there, or like I said, for an afternoon snack once a day, that's probably not a problem. How does bacteria in yogurt and kefir impact the gut biome? That's also a great question. And that's really one that I don't know that we have a full, complete answer to. And the reason is they literally are identifying the gut microbiome right now. The NIH started the project a few years ago after they did the genomic mapping. They wanted to do the microbiome mapping. And we know that they've gotten over 10,000 microbes, identified, and they're still working on it. So the thought is, and this is again where you might want to be talking to someone as far as a practitioner who deals with this. If you don't have a particular level of bacteria that you should, and you have a health issue, if that is in that bacteria or kefir that you're eating, that might be very helpful in recolonizing or seeding that bacteria in your gut. If it's a bacteria that you have plenty of, probably won't hurt. If you're eating a lot of it, it actually sometimes can make you sick. So it goes, the answer unfortunately is fairly broad. So let me back up and tell you what I would say right off the bat. If you are trying to balance the microbiome, and it's a great goal to have bacteria, I would recommend that you find out exactly what your microbiome looks like. And that can be done through testing. And once you know that, then you know what you might need to shore up and get better and stronger and support it. And you may know where you are lacking. So I think that would be the way to go, but that may have an impact. Oh boy, the toughest question so far is, what is the ideal breakfast? Depending on who you talk to, and I will tell you, I do think this is person dependent. There are some people who do well by doing that intermittent fasting, and way back in the day, we might not eat after dark. We might literally have finished eating by 4, 5, 6 in the afternoon, evening, and then we may not get to eat until 12 to 15 hours later. So that really was that intermittent fasting, because that is how it was going. Or you might only have enough food for maybe 2 meals in that day. So the ideal breakfast may depend on whether you need to intermittent fast, whether or not you have a blood sugar regulation, and then we want that balance between your good protein, that non-obese, grass-fed type of protein, as well as a complex carb and a little bit of fat. So as with anything, I think the ideal breakfast, my favorite thing is I love a great salad for breakfast. I may have some eggs, but I like my leafy greens. Of course, some people put their leafy greens in the eggs and call it an omelet. So there are different ways you can do. So I'm not sure that there's an absolute ideal breakfast in general, but I do know there are ideal breakfasts for individuals. And I apologize that I can't be more broad for you, but I do think it's really patient specific. Thoughts on detox? First off, I have to ask, when you say detox, what are you implying? Because there are so many things out there. Are we talking about doing a GI cleanse? Are we talking about doing a liver detoxification? Are we talking about just eating very cleanly and feeling better? So there are some things that you can do that actually enhance the phase 1, phase 2 detoxification of the liver, which I think is what a lot of people are talking about. So from that perspective, under supervision, I like detoxes. I do not like detoxes without supervision because they actually can bring to light issues the patient may not have realized they were dealing with, and it can cause problems. I particularly, and it's not technically a detox, but I don't care for when patients want to do the gallbladder flush, because that can actually put the patient in danger. So detox under supervision may be absolutely appropriate, but again, there's a lot of things out there on the web that may not be the healthiest thing to do. Is almond or coconut milk a good alternative to regular milk? Health benefits of almond milk versus regular milk. First off, we are about the only creature that has milk beyond the age of growth after the first or couple of years of life. So we obviously still drink milk all the way into adulthood for some people. If you do not have a casein, a whey protein, or any of the other milk protein issues, you don't have a gluten intolerance, sensitivity, or celiac, where you may have trouble with cow's milk because of molecular mimicry. They are too close together. The body sometimes mistakes them for each other. Then, and you enjoy milk, that's probably fine for you to enjoy dairy cow's milk. The health benefits of almond or coconut milk, it's a little harder for me to answer because some of them are fortified, some of them are not. The bottom line is that really should be a very small part of your day, maybe 6 to 8 ounces total, depending on what your caloric needs are. So if you want almond milk versus coconut milk and you have no issue with either one, I don't see a negative on the health. It may not, depending on how it's fortified, it may not be as impactful on your nutrients as it might otherwise be. But again, as long as you're not drinking gallons, I think that's perfectly fine. Like I said, six ounces is typically a serving. And if that's what you want to do, I think that should be fine. Do I recommend digestive enzymes with each meal since I have digestive issues? It all depends on your digestive issue. There are things in the stomach that digestive enzymes actually can make worse. So you need to have a diagnosis of what's going on before digestive enzymes are utilized, because they can exacerbate some problems. For a lot of people, they're perfectly fine and do their job without issue, but I cannot tell you if they're okay for you without you being evaluated. So that is something, if you do have digestive issues, I always ask folks, I will tell you, I've been doing this a little while now. I've been practicing there for 30 years. If you have an issue, no matter what you think you want to do about it, I encourage you to get it worked up appropriately. Because until you know what you have, we may be masking something. You may take those digestive enzymes and actually feel a little better, but they may mask a problem that maybe not serious now, but could become serious. So I always say, get the workup, find out what the choices are for you to address it, and then go from there. I just think that that's the best way to go about it. All right. I think we've taken care of, excuse me, let me check one more. There we are. We were good. Wow, what great questions. What a great audience. I really appreciate you joining us today. I will tell you, for those particular questions, especially the ones we couldn't dive in as deep as you might like, please call the number on your screen. Schedule a 15-minute consultation. Obviously, you can give more personal information that's very specific to you, and let our FM provider let you know what your options are. Get those answers. We're happy to do it. It's part of being a good neighbor here in the city of Chicago. On behalf of AMH, I can't thank you enough for joining us. And I want to tell you how much we appreciate you being a part of this. Please join us for future digital docs. You can visit us at aligned alignedmodernhealth.com and find out what's coming up. And with that, I say thank you and have a very healthy day.